Developing of the flu. At this time, we go across to the Felix Anderson studios of the Nation Station to say good morning to Health Promotion Coordinator Mignon Rolle Shillingford. Good morning.
Hi, good morning. And I want to wish a special good morning to all the listeners of DBS Radio. And of course, as Nazri just said, this is Mignon Rolle Shillingford, and I hail from the Health Promotion Unit of the Ministry of Health. And of course, if I'm here to talk health and wellness and, to impact information that will allow us to change our behavior.
Yes.
Just a slight correction in terms of what I'll be speaking about today. It's actually precautionary measures for all of Carnival. And
Beautiful.
Flu or influenza, common cold is just part of it. Okay? And of course, coming here to DBS, which I was listening to, I heard one of my colleagues, Mr. Fontaine, speaking about the flu. So I said, that is a very good introduction to what I'm going to speak about as well.
Yes, indeed.
So he was very detailed, and he spoke about flu and cold, and he spoke about the signs and symptoms, and that was very good, and even what you can do to prevent yourself from having the flu. So yes, I will start with the flu and just continue off from where he is. So we know it's carnival season, but it's also flu season, rum season, and we can also say other seasons, like things like gastroenteritis, which I will speak a little about later. So because we are also seeing increases in gastroenteritis, and we know when we have mass gatherings, a lot of people eating out, and when we have torrential rains, and Nazari, I think I'm a little depressed with that rain right now.
Oh my! I was just mentioning, because Israel was mentioning how nice it is to have the sun out, so early in the morning. But I mentioned to him that he should be careful, because when it comes to Dominica, you really can't be sure, when you might encounter a shower.
Yesterday we had the sun out early, and I was bright and I was happy, and then all of a sudden everything changed. And that's why we have been having rain since December. It's like almost every day.
And of course, the cold weather is not making the situation any better for the weather or for the flu.
Well, I love I love the cold and not the flu. I love the temperature. It's keeping us around this time. Last year we had started complaining already of heat.
Oh yes.
But yes, so there are a lot of things happening around now. It's a season for a lot of things. And of course, when we have this type of climates, and we have these torrential rains, when we have these mass gatherings, people normally let down their guards, So as I said, we would begin with the flu, and we just want to reiterate that the flu is something infectious. It's something that can be passed on from one person to another. So it's not like you get it and it's contained within yourself. But because the way it is transmitted is by respiratory droplets, so the infection, you sneeze, you cough, you use your hand, you touch surfaces, you touch money, you enter the bus, you use the washroom, the doorknobs, and it is spread, it's transmitted. So of course, what I'm saying is not new information. We talk about that all the time. We just came off from COVID, which has almost the same mode of transmission. Yeah. So we just have to be mindful how this is spread and what we can do, to limit or prevent ourselves from getting it. And even more so, taking it home to our most vulnerable persons, which are our elderly and children, who do not go out and party and have fun and whatever. We take those things to them.
One thing I know that we always do any festive season, when there's a case of the influenza, there's always some unique name. I wonder what name they have for the flu.
So I heard. So I was on another radio station day before, and I think the name is lit already, seeing that flu started a while now. But I heard one name thus far. One name, which is straight. Wilbos.
Oh boy.
So yes. So but I find we are late with naming it. I don't know if we have so many options or choices or why, but that is the only name I've heard thus far.
All right.
And it was just day before yesterday. So yes, so I mean we are so accustomed, and that's why I'm saying it's not new, that during this time, during the carnival season, it starts somewhere around November, Independence time, that we have those flus. And then carnival, because of the mass gathering and the number of persons we have coming in from different countries and whatever, then it picks up, and then we give it a name. Now, over the years, we have noticed that, the strains of the flu are a lot stronger, meaning that they are a lot more infectious, meaning it's able to infect people more, and also it also has a lot more complications, So you have persons getting those flu, and you hear them saying, "But Jay, nurse, that is the worst flu I get in my life. That from the gates of hell, nurse, you swear it's chikungunya I had again."
I've had it, and I must say I was quite shocked at how bad it was, and it lasted for a while,
Voila,
Yeah.
and it's the sickpale or the lasting effects
yeah.
and whatever is bad, So with that knowledge, we need to do better, because we have to always remember our health is our responsibility. Right? So we know we get those flus. We know the flus, this type of flu, are getting worse and worse every year. And to a certain extent too, we have a lot more people that are susceptible or have decreased immune systems, because it is not no secret. We have a lot of younger persons now having things like diabetes, high blood pressure. We have persons with asthma and sickle cell, and other immunocompromising situations. So the virus of the flus and the strains are stronger. They are more infectious. We have more people who have weakened immune system. So you can imagine the impact and the effect of individuals are greater.
Certainly. And as to what you said earlier about more complications, with the flu, it's a bit interesting to see how different the experiences are. Individual to individual,
That is correct.
For example, myself, when I had it, while I had the flu, I actually lost my voice, and it took a while for it to come back. And recently, a friend of mine actually got it as well, and he started to complain about stomach problems.
Okay.
So it's a wide range of effects.
And Nazri, you're hitting the nail on the head, because I mentioned that I'm also going to talk about gastroenteritis, or GE. And what is that? Simply is diarrhea and vomiting. Diarrhea and or vomiting, right? Or both. Okay? So if you have had soft, watery stools, more than 3 times, 3 of them, soft, watery stool, we already can say that you're having a gastroenteritis, right? And most times this is caused by bacteria and stuff that enter your body and goes into your gastrointestinal tract. But with the flu, we are seeing that persons are presenting with gastrointestinal symptoms as well, right? So apart from the malaise and muscle pains and the fever and sore throat and cough and all of that, people also exhibit vomiting, diarrhea, and those types of things. Why? Because we are swallowing the virus. 2, we may not be eating well at that time. You understand?
Yes.
For appetite, so the body is responding to it as well. Okay, so with flus, our greatest concern is that we do not know what impact a particular flu may have on the individual, right? We know our greatest persons most at risk are our children and elderly, and persons with chronic conditions or immunocompromised. But there are some people where anytime a flu hold them blows,
they don't flat.
That's just how it is. You understand? So we want to encourage the public to do everything that is possible to not get the flu. Okay? Because you do not know how it's going to react to your body.
Considering, although I found that the time during COVID-19 to be a bit traumatizing, considering the severity of the flu nowadays, especially this time around, would you recommend that we go back to some of the basic procedures that we would have during COVID, at least when it comes to the wiping down of things with rubbing alcohol and things of that nature.
And again, Nazari, you are on point and you are hitting the nail on the head. We should never have stopped it in the first place. Okay? So we need to continue with hand hygiene, hand washing our hands, whether it looks visible or not, because we are touching everywhere. We are touching everything. We are touching doorknobs. We are touching money. We don't know if somebody just used the $5 to sneeze into, because they didn't have tissue and it came out. We don't know when somebody came from the washroom and left, did they wash their hands? So these are things that we should have never stopped. You understand? Because infection, a lot of infections and diseases can be prevented by doing those simple things like washing hands properly with soap and water and cleaning off surfaces. Especially frequently used surfaces. Because we just spoke about the flu that the way it is spread is by sneezing, coughing, droplets being dropped on, surfaces or in your hand and your touch. So, of course, if you clean, you significantly decrease the risk of spread, right?
And I like to be honest. I'm not a huge fan of masks, but I will say that when I had the flu this year, it came with a severe sore throat, and I actually found it was easier to breathe with a mask on because the air that you're breathing in, it's somewhat warm, so it affects your throat less.
Yes.
So it would be a recommendation from me that if you have a sore throat, especially if you're in an environment that's cold, maybe there's AC or something of that nature, wearing a mask would actually help with relieving some of the pain that you would experience while breathing.
So we also recommend that during this time, if you have a cold, that you wear a mask. So we are saying that we should have kept all of it. I mean, the Ministry of Health, Government of Dominica do not need to come to tell you that if you have a flu, that one, we want you to stay home. Stay home. Okay? Do not come and spread it. And two, you may decide to use a mask because one, it helps you and it helps me and everybody else. It helps everybody else by when you sneeze or you cough, it limits the amount of droplets on countertops, in your hand, whatever it is contained in the mask, right? So if we understand and we understood then that it is spread this way, having a mask and you sneezing, coughing, whatever, it reduces. Because, sometimes just by speaking, we send droplets. Right, we spray it, we call it. Instead of saying it, we spray it. So wear your mask. For your own protection, look, I'm getting a testimony right here.
It was surprising how much less painful it was, to breathe with the mask because of the sore throat.
So it's helping your own self, helping you to, feel better under that warm temperature. And we know for sore throat and things like that we use, warmth. Right? So these are the measures for real, for preventing of spread. So you want to wash your hands properly with soap and water. You want to continue to clean surfaces, especially those that are frequently used. If you have the flu or you're feeling fluish and that type of thing, we know that flu is circulating right now. You can use your mask and we want you to stay home. Okay? Now, there are some times that, when you get the flu, certain things may happen. So, for instance, you may end up getting a complication. And complications just means that it has moved to just the simple symptoms, and now they have more symptoms that affect things like your breathing. And that's like your pneumonia. Okay? So, persons can end up with pneumonia, which is more critical, and they get breathless, and they may have to be hospitalized, and they may have to be nebulized, and all that type of thing. So, we want you to be mindful about that, you understand? And also, we would like you, because we are having this outbreak, the Ministry of Health would like to know what strain of flu, what type of flu, which flu is circulating. And there may be multiple at a given time. So we would like you to come in and sometime we would test you. We want to know if it's flu for true, we want to know what type of flu, and we want to know if it even is still COVID. You know, that type of way. So it is important that you go to your health center. I mean, if it is not something severe that you need emergency care, please don't flock up the accident and emergency department at the Princess Margaret Hospital. There are
China
health
Friendship
centers.
Hospital.
China Friendship Hospital, sorry. We have health centers throughout the island that are in 7 health districts, and then we still have the smaller sentinel health centers that we call type 1. Go to your health center, go to your nurse, you know, she will check you, your doctor will check you, and they may take a sample so we can know what is going on. Okay, so yes, so we spoke a good bit about the flu, and as I said, my colleague Mr. Fontaine had already spent some time on it.
Yeah.
So the other thing that can happen during carnival season is the spread of gastroenteritis. And as we said, gastroenteritis, which is GE in short form, is diarrhea, most likely described as diarrhea and vomiting, and or you may have both of them together. A lot of time, if you have had 3 watery stools, not pasty, but water stools, then we can say, okay, yes, this may be GE. You may not have vomiting, and you may have nausea, so that obsessed feeling, bloating, that type of thing, and have diarrhea. Guess what? The main mode of transmission of that is also in terms of hands, dirty hands, not wiping. You understand? So see how important just hand washing, hand hygiene is?
Oh, yes.
That's why we should always do it, you know? And if we do not have water available, that we still work with a little alcohol here and there, and, you know, just
wipe down.
You know, wipe down surfaces and wash our hand. A lot of it, now, we haven't pinpoint, you know, so I say we are seeing a number of cases of GE as well. We haven't pinpoint exactly what is the cause. So there are 3 main areas that we think that can cause this increase in gastroenteritis around this time. 1, the torrential rain. So it has been raining since December, I said, almost every day.
Yes.
That means waterways can become contaminated. So from our normal pipe, sometimes it's visible, so you can see it's looking brown. Sometimes it may not be visible, but we know microorganisms may be in it because we had a lot of rain. Also, we know a lot of our Dominicans, we use the Sus water, right? So when it has a lot of rain as well, you know, the Sus water can become contaminated, right? So that is one of the ways that GE can spread, right? So you drink the water, it has microorganisms in it that can affect you. So we are advising that you boil water, okay? Some persons can afford to buy bottled water or use bottled water. Some persons use bottled water already only. But we're not putting no strain on you. You know what Daddy Chess just said while I came in the studio? We want more pay. So we know it's hard, it's difficult, you know, for a lot of persons. So we don't want to put you under pressure, right? So boil your water. And when we mean boil, not just when you start hearing the bloop bloop. You know, when you start hearing the bloop bloop and boiling, it only means that it has reached 100 boiling point, which is 100 degrees. But we want you to keep it that boiling for at least about 3 minutes. Okay? So boil your water about 3 minutes and then put it in a clean container because you don't want it to defeat the purpose that you just, right?
Yeah.
And then use your boiled water. Now, the other way we think that this G could be caused is because we have a lot of mass gathering, so a lot of people vending, right? So a lot of people are purchasing food, a lot of food preparation, and I can tell you the Environmental Health Department have been on the ball in terms of getting people to renew their food safety certificate, right? And to have it visually displayed when they are selling food. So all before the carnival season, you know, although some people didn't take advantage of it and like to wait last minute, or before the seasons and whatever, since before independence, they have been having numerous trainings all over the island. And, of course, during activities like that, they beef up on their inspections during programs.
Because I was going to ask, what would what do patrons need to do to ensure that when they go to a vendor to purchase food, that the food that they're getting is, up to the standard that it should be?
So we are coming to there. So yes, so one of the things, the precautionary measures is to ensure that